This is Dr. David Hill, and today we're going to be talking about decongestant remedies for infants. Now, infants have very small nasal passages, so it's really easy for them to get congested. Some infants are born with some degree of congestion because of the small airways they have in their nose, and they're always kind of snurfle and snort and snore until they get a little bit bigger and that airway grows big enough for air to pass easily. Some infants will develop nasal congestion as a result of gastroesophageal reflux disease. The stomach acid and stomach contents will wash up into the back of the mouth and up into the area behind the nose and cause irritation and inflammation of the tissues that carry air back there, and that can be a cause for neonatal congestion. Then, of course, there's colds. Even newborn infants and young infants will still get colds from time to time. They may have a very runny nose, certainly a stuffy nose. Now, newborns and infants have to breathe through their noses when they eat. So nasal congestion is annoying for an older child or an adult, but it's a real problem for infants in terms of getting all the food and all the nutrition that they need. So when the nasal congestion becomes bad, you want to try and fix it. Your first question is, what's going on? Is it a cold? Is it reflux? Is it just the way they're put together? You may want to consult with your baby's doctor to try and get a better answer to that question. However, in the meantime, say it's late at night, you're going to bring them in the morning, what are you going to do now? Your best bet is to use some nasal saline drops. Now, you can make these at home. All you need is 1 cup of water and a ½ teaspoon of table salt. You put the salt in the water. I'd probably microwave it or boil it to make sure that it's clean and completely dissolved, and then, of course, you'll want to let it come back down to room temperature. You don't want to be putting hot water in a baby's nose. But once the water is down to a tepid temperature, you can take a medicine dropper or even just a wash rag and dribble a few drops in each side of the nose, and then take that little rubber suction bulb you probably got when you were at the hospital. It's probably blue or dark red in color, and just put it right at the opening of the nose. You don't need to jam it way in there, just right at the opening after a second or two, and suck out the boogers and the snot and the water and what's in there, and usually that'll give your baby some temporary relief, often at least long enough to get a good meal in and maybe get the beginning of a nap. There are some medicated drops that we can use as a nasal decongestant in babies, but we use them very rarely. Usually in babies who have some sort of anatomical problem with their airway that's making it difficult for them to breathe. Those drops usually contain phenylephrine or oxymetazoline, both medications that shrink the blood vessels of the tissues inside the nose and reduce swelling. The problem with those medicines is after you use them for as little as 3 days, it's very difficult to stop using them. So those are now prescription medicines, and I really would not recommend using them unless your baby's doctor or even ear, nose, and throat doctor has recommended their use. So if your baby's nose is stuffed up, there's a few reasons it could be: anatomical, reflux, or a cold. Start with some nasal saline, and then you might ask your doctor if there's anything else you need to do. Talking about curing a baby's stuffed up nose with decongestants, I'm Dr. David Hill.